We tend to go about our daily lives rarely thinking that we'll need a hospital, yet at the same time always assuming that one will be there if we do.
But our hospitals are facing tremendous financial problems right now, and the leader of the Maine Hospital Association says sooner or later that pressure will make healthcare services harder to get. 207's Don Kerrigan is here with more on this story. Hey, Don.
Hi, Sam and Rob. Yeah, this is a situation and a story nobody really wants to hear about, but it's critical that we understand what's going on, because in a lot of parts of Maine we were told hospital care is going to have to change. It may be for tests, it may be for treatment, or maybe an emergency. And when we need it, we depend on the hospital. But way too many Maine hospitals are in trouble. So the majority of Maine's hospitals are losing money.
Yeah, probably about half at any given time.
Okay.
Yeah.
Are some of them at risk of having to shut down?
Oh, I don't think there's any question.
Steve Michaud is the longtime president of the Maine Hospital Association. It lobbies government and works on strategies for sustaining Maine's 34 nonprofit hospitals. And he is sounding the alarm. Are Maine hospitals in general at a crisis point?
Yes. Not all of them. But I would say for the first time in my career, I would say that a very large percentage of them are, yes.
It's been building for years, he says, but the wake-up call for the state may have come a few months ago at Northern Light Healthcare in Bangor.
I mean, it's well documented that Northern Light, our second largest system, losing 120, 140 million, depending on the year. We've never seen losses like that. We're used to hospitals losing some money, but not tens and tens of millions of dollars.
So what's happening? Michaud says part of it is the familiar Maine problem. Our population is old, and we have lots of small rural hospitals. It's been hard for years to find enough staff at those hospitals. Baby boomers are retiring, meaning more staffing issues, and then COVID.
It's a challenging job anyway to be a nurse or a doctor or a technician, whoever you might be, but the pandemic literally fried our workforce.
Hospitals had to bring in very expensive traveling nurses and other staff to fill those gaps. Travelers are fewer now, says Michaud, but hospitals are still having to use them to meet critical staffing needs. Add to that, we have a tremendous number of people with government health insurance, Medicare and Medicaid, which does not cover the full costs. And the demand for care never stops.
As I always say, societal ills land in the hospital emergency department. People don't realize that, but it's the truth. Opioids, behavioral health, homelessness, you name it, ends up in the hospital emergency room.
One symbol of all these problems, smaller hospitals like Waldo County General in Belfast have been closing their obstetrics units, not delivering babies because of cost, staffing, and low demand from an aging population.
It's something I don't like to say, but we're not done with the closure of rural OB units.
It is, he says, a large and complex and very difficult problem to solve, and money is essential. Does it have to start with Medicare and Medicaid providing more payment? Is that the root of it?
Yeah, that's a big part of it. You've got to start with the public payers because they're the poor payers. They are the ones that don't pay well and cause us to have to shift our costs to others.
Michaud says state and federal governments also need to put more pressure on commercial insurance companies to pay more of the hospital costs. But he is not confident those things will happen. So Michaud says Maine's healthcare system will be forced to change.
The system we have is not a system that we can afford anymore. Let's just be honest. For the average person, we're gonna lose some services. We're going to be waiting longer, and we're going to be driving further.
And at its heart, this problem is about Maine people and families, about the places they live, and about the health of all of them. Because all of us, he says, are going to feel it. Steve Michaud says the nursing shortage is getting better, but we still need more nurses, and there's a doctor shortage in a lot of places. I've heard from people even up in the Bangor area say it's hard to find a doctor, and of course, as we know, can be hard to get timely appointments. All of this is coming home to roost, and the pressure is going to be on Congress to come up with more money. Who knows where that'll go?
Yeah, this is kind of a slow-moving crisis where it doesn't happen all at once, but the waves just keep rolling in.
Right, and nobody wants to lose what they've got.
Yeah. All right. Thank you, Don.